The CDC is seeing an increase in the number of children being diagnosed with walking pneumonia.
Comes as kids are getting ready to trick or treat for Halloween. WGN's Angelica Sanchez is here with what the health professionals want parents to know.
That's right, and there's plenty for parents to know. Doctors say symptoms from the infection will typically go away on their own. That's with plenty of rest and at-home care, but there are rare cases that require serious medical attention. What's concerning experts is the number of preschool-age children being diagnosed. The changing of the seasons always brings challenges to the immune system. This year, health experts are noticing a rare uptick.
All of a sudden, with this surge, we're seeing it happen in these younger children, whereas we hadn't seen that before.
Health experts say there has been a rise both locally and nationally in patients diagnosed with Mycoplasma pneumoniae, better known as walking pneumonia. The Illinois Department of Public Health has issued an alert with childcare providers and schools to heighten awareness.
Typically, we may see 2 to 5% of kids infected with this organism. Now we're seeing positivity rates between 10 and 20%. We are seeing a lot more children in the 2 to 4 year old age range.
Doctors at Lurie Children's Hospital of Chicago say there's no clear answer yet as to what is causing this surge, but there are theories.
One theory is that we're still seeing some of the effects of the COVID pandemic, where essentially because of the social distancing, that a lot of pathogens sort of went dormant.
Doctors say walking pneumonia symptoms can mimic the common cold, but children under 5 may also experience diarrhea, sneezing, stuffy or runny nose, vomiting, and watery eyes.
I think that if a child or an adolescent were to have such significant work of breathing that they had difficulty breathing at home, or if they were unable to keep themselves hydrated, or if their oxygen levels were lower than usual, then those children would need to be hospitalized. But for the most part, can be managed at home.
Now, there is no vaccine to prevent walking pneumonia, but there are ways of protecting yourself and others. Doctors want parents to teach children the importance of hand washing and covering coughs and sneezes as the infection spreads through droplets. Back to you.
All right. Thank you very much, Angelica.